artists,
teachers,
chefs,
pastors,
doctors,
coaches,
athletes,
Kentuckians like you.
join the team.
Join the team.
Únete al equipo. Get your vaccine.
Get your vaccine.
Get your vaccine.
Get the facts at kycovid19.ky.gov.
All right. It is 4 o'clock on Wednesday. It's that time this week we're coming together to remember we're going to get through this, and we're going to get through it together. I want to thank Joyce Cheng for the new mask, the new Team Kentucky mask. Appreciate your work. Let's start with a bit of good news. After what I would describe as a very difficult legislative session, at the end, we saw some bipartisanship. We saw some teamwork, and the governor's office, along with the majority leadership and the minority leadership in the House and the Senate, yesterday were able to direct funds from the American Rescue Act that are going to create tens of thousands of jobs across this Commonwealth. They're going to begin the process of getting broadband to every single home in this Commonwealth. They are going to upgrade our water and sewer infrastructure without raising your bills, and going to repair and replace so many of our schools around Kentucky. At a time when we want to make sure we sprint out of this pandemic, we get out of this recession, we want to use these dollars to create jobs and economic activity. And I think there was a lot of good work that came together to get a good start on that. $300 million was appropriated for broadband. We're able to work through how that would look. It goes to unserved areas, underserved areas, and economic development opportunities. We'll be able to use the speed test we've talked about a lot, the map of Kentucky that shows where we desperately need broadband in the first place and where we need faster internet in the second place. $250 million was appropriated for water and sewer projects. $150 million of that allocated out for grants to various counties based on population. Counties will have to apply for that, but these are grants. They're not loans, and so they're going to go a long way. $50 million of that is for areas with consent decrees or do not have clean drinking water. Then there's another $50 million for larger or more complicated projects. And the last is between two different groups. There's about $190 million for school and vocational school repairs and replacements. Again, normally these are financed through borrowing and bonds. This is going to put a ton of people to work. We had good conversations in that last day and really in the last 2 weeks leading up to it. So while overall, I think we'd all like the session to have gone differently. And while there's still going to be some working out the legality of some of the bills, I think we had an ending that gives us at least hope for the future and is building some trust. All right, big news of the day. This coming Monday, we are opening vaccinations to everyone over 16 for Pfizer or 18 for Moderna and J&J. That will be a complete opening of all of our vaccination sites to everyone who qualifies under the FDA and the CDC's decisions. This is a good day. It means that we will beat the president's request by a month to have it opened up to everyone. There are a couple of reasons why we're doing this. First, we are seeing in a number of states, including Michigan, Wisconsin, New York, New Jersey, and others, an increase in cases, an increase in hospitalizations, and it's happening amongst younger people. What we're seeing is that the vaccines work, and older Americans have gotten it. We're seeing more younger Americans ending up in the hospital. This, we believe, is because of the more aggressive variants. We want to get ahead of them. We're also seeing some appointments open. We want to make sure that we fill those. So starting on Monday, if you're 16 and up, you qualify to get this vaccine. No other limitations out there. So make sure you make your plan to get your shot of hope. So to correspond with that, well, it's about a week later, and recognizing we vaccinated about 700,000 Kentuckians in just the last 5 weeks, we're also about to open our largest vaccination site. Beginning April 12th, U of L Health will open 24 lanes to vaccinate Kentuckians at Cardinal Stadium. We talked about this before, but it is now getting closer, and we are accepting signups now. You can sign up for your appointment at 502-681-1435. We're going to vaccinate 4,000 to 5,000 people a day. So if you call now, you can probably get an appointment for the very first day, April 12th, especially if you are a Kentuckian that this just opened up to. This is a good chance to get through and to get your vaccine. We could not do this alone. As Dr. Benaputi says in this upcoming video, we hope to vaccinate nearly 200,000 citizens in the 7 weeks that this site is going to be operational. Here's a video from President Benaputi.
Thank you, Governor Beshear. The University of Louisville and U of L Health are thrilled to host the largest drive-through vaccination clinic in Kentucky. Beginning April 12th at Cardinal Stadium, U of L Health professionals and volunteers will administer the COVID vaccine. We're expecting about 4,000 to 5,000 people per day. Over the 7-week run, we hope to vaccinate nearly 200,000 citizens from throughout the Commonwealth. A massive undertaking like this cannot happen without the participation and support of hundreds of committed volunteers. First, I would truly love to thank and celebrate the many people who are donating their time and energy to this effort to protect the health and safety of our citizens. I'd also like to thank you, every single citizen of our Commonwealth who has worked to prevent the spread of this virus. Thank you for social distancing and the continued wearing of your masks. I applaud those who've already rolled up their sleeve for the vaccine, and I encourage everyone to do the same when it's your turn. Our Cardinal Stadium site will be open to everybody, ages 16 and up. For more information or to make an appointment, go to uflhealth.org. The University of Louisville and the University of Louisville Health are honored to work with our state government to provide vaccines to so many of our citizens. We look forward to seeing you there. To quote that famous song in Hamilton, don't throw away your shot. Go Cards!
Well, thank you to Dr. Benaputi. Thank you to U of L Health, and to the thousands of healthcare workers and volunteers that are going to make this happen. Folks, just in this site alone, there are 200,000 appointments that you're going to be able to sign up for. So get on phone, dial that number, 502-681-1435. Reserve your spot right now. You get on the phone, you get through, you will be able to reserve a spot. Let's get this done. Let's get vaccinated. Let's reach herd immunity. Let's defeat COVID-19 for good. To do that, we got to make sure that everywhere across the state, we are filling up our vaccination openings. Today, here are some of the areas that have a number of openings. Norton Healthcare in Louisville right now. You can go to their website. You can get an appointment. The Northern Kentucky Convention Center, it's been a great facility. We've had a large number of people coming through. There are some openings there as well. If you're in the Northern Kentucky area, get on and sign up and get your vaccine. Kentucky Dam Village Convention Center in Gilbertsville, folks, there are a number of appointments available. We need you to make sure you take one. And finally, Baptist Health in Madisonville, they are ready for you. They can get you in for your appointment. Those are just a couple of areas. So if you're in Western Kentucky or in Louisville or in Northern Kentucky, you can get your shot here probably in the next couple days to a week maximum. As long as it's the beginning of next week, it's anybody and everybody who qualifies for the vaccine, 16 and up. So let's get that done. Speaking of vaccinations, we've been asked about those in in our state prisons. The Department of Corrections is now scheduled to receive extra Johnson & Johnson, and so that schedule is moving up. They are scheduled to receive the amount they need for all their vaccinations Friday, April 2nd, or Monday, April 5th, depending on the shipping. The plan is that all interested inmates will receive a vaccine as soon as next week, with the exception of the Kentucky State Penitentiary and the Western Kentucky Correctional Complex, since they're just recovering from an outbreak. We're going to administer the vaccine at those two prisons as soon as it is safe to do. So all of our schedules moving up today. Now let's look at table 1 on vaccinations. As of today, we've had 1,352,477 Kentuckians receiving at least their first shot of hope. That is excellent. It is a better rate per population than any of our neighboring states, but we got to keep that up. It's going to require us to continue to be enthusiastic and to get this vaccine to people, but also, folks, and those in the media, please let people know where these openings are. I believe people want to go and get the vaccine. That demand is still strong, but we may be working with harder to communicate with populations, and we can use your help. Let's look at table 2. It looks like our week just started yesterday for this coming week of vaccinations. Vaccinated 20,514 people yesterday alone. That's a pace on a Tuesday that suggests good things this week. Another number that I saw today that I think is a good sign. We now have over 70% of our 70-year-old and up population vaccinated, and I know working hard on getting the rest of that portion of the population. But that's a good number, being above 70. We want to see it continue to increase. We're going to start trying each one of these updates to give you an update on variants of concern. All we have is a B117 variant. That is the UK variant. We now have 66 total cases, including 10 in Allen County, 10 in Jefferson County, 13 up to 13 now in Kenton County. Separately, this morning, it happened about 7 o'clock. We received great news, fantastic news for Kentucky kids and their parents. Pfizer and BioNTech reported their COVID-19 vaccine was 100% effective in their very first trial with kids 12 through 15. Remember, they've already authorized 16 and up, or the CDC and the FDA have. So this is 12 to 15. It included about 2,200 children, and none of the children that had received the vaccine got the virus, only a certain amount of kids in the placebo group. With those results, Pfizer said it asked U.S. health regulators in the coming weeks to expand eligibility of shots to kids 12 and up. It means these kids could be vaccinated before the next school year. That means just about all middle and high school students could be vaccinated, certainly before they step in the classroom in the fall, and giving us more opportunities than our kids, while back in class right now, have. We could be back to a normal. Certainly, we all hope to be back to a fully normal by the fall, but this is one way that's going to help get us there. Last week, Pfizer started testing the vaccine in children ages 6 months to 11 years. Once all of our kids are able to get a safe vaccine, the sky will be the limit. And so, again, really exciting news that I saw on the treadmill about 7 this morning. Got the day started the right way. Earlier today, I also signed an executive order that keeps in place protections intended for our people to stay safe at home while providing relief for landlords and utilities as the threat from COVID-19 persists. The executive order I signed today follows a similar move Monday by the U.S. Centers for Disease Control and Prevention, which extended its federal ban on evictions. From the beginning of this crisis in Kentucky just over a year ago, our administration has acted swiftly to keep people from losing their homes, while at the same time to try to provide relief to landlords. Monday's move by the CDC is the third extension of its federal eviction moratorium, which the agency first issued September 4th, 2020. These protections remain sorely needed. Even with the rollout of the safe and effective vaccines, we aren't over 50% yet. We're just over 40% of our adult population that have been vaccinated. We are not out of the woods, and in fact, we're seeing cases increase in other states. So we've got to be able to be healthy and safe at home until everybody can get vaccinated. These orders and the relief funds will continue to keep us safe and poised to sprint out of this pandemic. Remember, large amounts of money available to landlords and renters at teamkyhherf.ky.gov. I know we already have over $3.8 million that has gone out the door, and rental assistance just from this new round, that's on top of the first $15 million that we did earlier. We also have a significant number of applications that have come in. We are going to be getting the dollars out for those soon, but there are many, many more dollars that are available. We think that there may be up to $200 million that people can still apply for. So please make sure you take advantage of that. Today's COVID report suggests it's going to be real close this week, and whether or not we have our 12th week of declining cases or we start to see a plateau. So today we're reporting 815 new cases. That is more than last week, but it's less than the week before that and the week before that. We got 35 additional people hospitalized. We don't like to see that number go up. 19 additional people in the ICU, 11 additional Kentuckians on a ventilator, all of that due to COVID. So we're going to watch that. We have seen fluctuations, and this isn't a large one, but we're going to watch it. Our positivity rate is up slightly to 2.96%, but that is still certainly under 3. Today we have 22 what we call new deaths, meaning those come up through the local health departments, as well as 3 additional deaths from our audit of death certificates. The 22 new deaths include an 83-year-old man from Barron County. This is a very recent March death. We're thinking about him and his family along with everyone else's. 79-year-old man from Boyle County, also a late March. A 75-year-old man from Caldwell County. This is actually from November. A 77-year-old woman from Crittenden County from October. A 65-year-old woman from Hardin County, March. A 66-year-old woman from Hardin County, March. A 79-year-old woman from Hardin County, March. And an 89-year-old man from Hardin County, March. Hardin County's had a tough last couple of weeks, and we're thinking about that area and its people. A 83-year-old woman from Harlan, December, and 66-year-old woman from Jefferson just a few days ago. A 70-year-old woman from Jefferson passed away just a few days ago. A 66-year-old woman from Jefferson several days ago. An 80-year-old woman from LaRue in March. A 66-year-old woman from Laurel, March. 92-year-old man from Laurel, January. 81-year-old woman from Letcher, day after Christmas, December. 68-year-old man from Logan, March. 72-year-old woman from McCracken, January. 96-year-old woman from Nicholas County, December. 62-year-old man from Simpson County, a couple days ago. 80-year-old man from Warren County, early March. And a 78-year-old man from Whitley County in January. The audit deaths include a 65-year-old man from Boyd County, January, an 88-year-old woman from Hardin County, November, and a 71-year-old woman from Marshall County, December. That is still hard after a year and a couple months, but let's look at really, really good news. Let's put up long-term care. Second time in the last, week and a half, we have 0 new cases amongst long-term care residents. Vaccines work. Everybody get them. We only have 3 new staff. We have 0 new deaths to add to this toll. And folks, these vaccines work so well that we have gone from the overall share of deaths long-term care made up, 68% at one point, and it's down to about 40. So vaccines work. They save lives. They save lives even of the most vulnerable. So everybody else, go out and get it. All right, we'll now go for a UI update to Amy Covich.
Thank you, Governor. We just have a few quick updates today. First, I just know we've gotten a lot of questions about the change in terminology you're seeing on the updated web portal from under investigation to fact finding. Please don't be concerned about that. It was an intentional terminology change to more accurately reflect what's happening. Under investigation can imply that you've done something wrong when very often we're just in the process of reviewing information. So that is going to be the terminology you'll be seeing on an ongoing basis. So don't be alarmed by that change, and you can expect to see that going forward. Also want to remind you of our upcoming Career Center reopening. 13 of our new career centers are going to reopen on April 15th. Those 13 locations are Bowling Green, Covington, Elizabethtown, Hazard, Hopkinsville, Lexington, Louisville, Moorhead, Ashland, Owensboro, Paducah, Prestonsburg, and Somerset. Again, you'll have to make appointments. We can't have lines and people showing up unexpected because of COVID, but you can make those appointments on the kcc.ky.gov website here soon. It'll be using the same appointment portal that you have been using to make the virtual appointments, which will still also be available. I know we've gotten some questions in the last couple of weeks, what the staffing levels are going to be at the career centers. We're still working out those details based on the availability of staff in those geographic areas, and based on the knowledge level of people we have at those locations. We should have updates on those in the next week or so. But also know, in addition to receiving UI assistance at the career centers, you can also get assistance with finding a job, job training, apprenticeship, vocational rehab services, and adult education, including the free GED program that is being offered right now. So please check out all of those services and you will be able to make those appointments online. And finally, just to give you a little bit of an update on the legislation that was passed for UI during the session that ended last night. Of course, we've talked quite a bit about Senate Bill 7 that allows waivers of overpayments. We'll be rolling out that program soon. And once that is rolled out, if you get a notice, you'll have 30 days to respond to it to request an overpayment waiver. But other than that, in the executive branch budget, the General Assembly did give us the requested money for the UI system modernization program out of general fund dollars, but did not give us money for additional staff. We will be using our existing federal funding for that, but rest assured we will still have the career centers open for you soon for in-person services. Last night, we also received an appropriation of $575 million of the ARPA funding to pay on the UI Trust Fund loan. So that is great news. It allows us to keep our UI Trust Fund solvent and hopefully keep the tax burden down for our small businesses. And of course, a bill was passed last night also to confirm our pre-existing plan to reopen the 13 career centers. So with that, back to you, Governor.
Thank you. And as Amy mentioned, some good news on the UI front, but one real challenge we have is, as you remember, we have an outdated system. We're working on that. The RFP is out and is being evaluated now, but it will take time to implement. But the other issue was the 90+ staff members that were cut many years ago before I came in the last administration, and the regional centers that were shut down because we did not get state dollars that will carry forward in years. The jobs that we offer to beef up our staff are time limited, and that may create, and we believe it will create, a bigger challenge in hiring people. So certainly we had hoped that after seeing mistakes of the past, the legislature would put the regular dollars in, knowing that just because times may be better a year from now doesn't mean we cut staff. That's the mistake that was made in the past. So we'll continue to work with them, hopefully through some new relationships and building of trust to try to get that rectified as soon as we can. Also, everybody, this is Holy Week. I want to say Happy Easter. Because of Easter, our reporting is going to be a little bit different. Tomorrow, Friday, and this weekend, we're going to provide our daily COVID numbers via social media. On Friday and Saturday, there will be a limited report with basic information, and on Sunday, there will be no report. We will give Sunday and Monday's report both on Monday. Our hardworking public health team deserve a little bit of a break, and we want them to be able to be with their family all Easter this Sunday. All right, with that, we will open it up to questions because we've been moving along. We will start with Debbie Yetter from the Courier-Journal.
Hi, Governor. I wondered if you have considered a legal challenge to House Bill 563, the school voucher bill that was passed, and also, is there any kind of update on the lost wages assistance program? Any money for that?
Let's go over to Amy Covage for lost wages assistance, and then we'll come back on 563.
No specific update on the lost wages assistance, but we are awaiting additional federal guidance regarding the proper use of ARPA funds and whether or not those could be used there, and any remaining opportunities for additional FEMA funding.
Well, we're still certainly reviewing any and all options. Obviously, I think the quote-unquote school choice bill has major constitutional issues. I also think it's bad public policy to take money out of public education at a time when funding levels may have dipped below the constitutional requirements. Now, it may well be that as opposed to initiating a lawsuit, we're the group sued because the Department of Revenue is who would offset the taxes otherwise owed by individuals who can put it into these private organizations that then provide it to it then helps individuals attend private schools. Daniel DeRocher from the Lexington Herald-Leader.
Hi, Governor. So obviously we just finished back-to-back days of going to midnight in the legislature. And with that, the question is, what's next, right? And so the biggest thing here is obviously we've got this federal stimulus money. The legislature has allocated about $1.3 billion of it. Where else would you like to see the remainder of that money go? And do you expect to call a special session to allocate that money? And then also just in terms of the bills that they were rushing through, do you expect to veto some of those bills?
Well, too early to know if we'll need a special session or deal with it eventually in a regular session. But I will say that our ability to come together and even agree on language up front on how to deploy dollars to the UI Trust Fund, to water and sewer, to broadband, and to school construction is a real positive sign. One of the first times we've been able to work together that closely, and I think it's going to be good for everybody. So I think we are off to a good start in properly using the ARPA funds to create jobs, to stimulate the economy, to upgrade our aging infrastructure without raising people's bills. What we'll need to talk about in the future is I'd still like to see a relief portion to small business, to affected industries, and to individuals. The conversation on that has been positive. It's been a lot about where people are otherwise getting that assistance, but I hope that we can get to a point where we can provide some of these dollars for that. We're also still awaiting the guidance from Treasury and other areas that may open up other possibilities. But I'm optimistic about our ability on this topic to come to agreement and ultimately to a good agreement that helps Kentuckians. I believe the water and sewer piece is going to be transformational in providing clean drinking water to everybody. And just think about it. Normally we do one of these projects. Who pays for it? We do. They raise our rates over a period of time. There's a chance to modernize that infrastructure, to run water and sewer lines to industrial parks and other commercial activities, to homes where it's not there. So it's really exciting. We are going to be going through legislation. It'll be next week before I start taking actions on it. I'm going to take a few days off with my kids, and I hope everybody else has an opportunity to hopefully do the same over the coming days. I anticipate that we will sign a lot of it, and there's likely to be a veto or two as well. Corinne Boyer from WEKU.
Hi, Governor. Is the state tracking how many vaccine doses are going unused? And now that vaccines are going to be open to everyone over 16, is there a way for vaccination sites or pharmacies to notify people if they have unused shots available? Thanks.
So we have not had, to our knowledge, one dose wasted in Kentucky since our program began, and that's really good news. What we are seeing is areas where they believe the demand is waning, where they aren't seeing as many appointments, will call us up proactively and say to reduce the amount going to them or let them work through what they have because they can store it properly and have plenty of time until we send them more. So what we're doing is we're redirecting a little bit based on demand. Was there a second piece to that question? With our move to 16 and up, what we have on our website, if you go to it on the vaccine section, is where there are open appointments. There are open appointments all across the state right now at different locations, ranging from Eastern Kentucky, from King's Daughter in the Ashland, Carter County area to Pikeville Medical Center, moving over to Kentucky Dam Village, down in Madisonville. We know we have them in Louisville. I believe we have some openings at the Kroger Field location run by UK, and anywhere in the state, if you can drive and get there, the Cardinal Stadium vaccination clinic starting, a week from Monday, a little bit over that, 4,000 appointments a day. You can go ahead and get that on the books. So there are plenty of appointments to sign up for right now for next week. Catherine Collins, WLEX.
Hi, Governor. On today's COVID report, do you believe there's something different about Kentucky to account for why some states are seeing increases in cases right now and we're not? Or are we just, is it possible that we're just lagging behind those other states?
Well, the data will prove that out. One thing that we did by taking those difficult but necessary steps in November is we pushed down our curve, just like we always talked about Philadelphia versus St. Louis. Well, most of the country went Philadelphia in November. And while we lost a lot of people, we lost far fewer than many other states and had fewer cases. Now, when we push down that curve, we elongate it, right? And so it's going to take us longer to get down to the low point than the ones that peaked and then rapidly fell because of the number of people who got infected. But I also think that we've done better than many states, and we're also sticking with it. Now, you got other states that have undone their mask mandate. Well, you're going to see cases come back. You've had other states that maybe relaxed too quickly. As we're going to get through this, we're going to beat this virus. We're going to be able to eventually get rid of every single restriction we have. But we can't do it too quickly, or we'll have people that haven't been able to get vaccinated die before we get to that finish line. And it is so close. So I think it's a mixture of a number of things. It goes all the way back to the steps we took in November, to Kentuckians doing better and better. And our vaccination rate is also helping us be where we are right now. Shelby Smithson from WKYT.
Hi, Governor. When you look at the percentage of people vaccinated by county, there's a wide range in those numbers. So for those counties that are underperforming, so to speak, do you believe that's due to lack of demand or inability to distribute the vaccine as quickly? And is there any kind of state-led effort to get those counties up to par with others?
We now have vaccination sites within a short drive of everywhere in Kentucky. So it is there. Sometimes it can be difficult to get information to groups that are out there, but no, the supply is there and it's ready. You know, there were some counties in Western Kentucky that were lagging. We have almost 1,000 appointments available, more than that right now in Western Kentucky. So it's there. We just need to keep encouraging people to get the vaccine, but also by opening it up the way we have, we're going to see, you know, more and more people come in to get it. Again, it's going to take some time to convince those that are hesitant, and there may be some that'll never get it. But we also need to see strong local leadership, which we're seeing in places. It makes it harder in places where leaders may have downplayed the virus. I hope now they spend twice as much effort in pushing people to get vaccinated. You see local leadership in a place like Perry County and Hazard. Mayor talks every time he has the opportunity. He's also a school superintendent about how that county is one of the tops per capita in the state. And it's because they have worked together and pushed out the right, accurate message about the science over and over and over. But you will see us continuing to ramp up our communications. That's paid communications, that's radio ads, billboards, more use of local leadership as we move forward. So our campaign on that side ramps up as we start seeing the hesitancy, trying to use the dollars at the time that they are most effective. Joe Ragusa from Spectrum News.
Hi, Governor. So I want to ask about a specific piece of legislation that was passed late last night, and that was House Bill 321, which is the West End TIF proposal that lawmakers have been talking about for the last month or so. That's kind of meant to drive up economic revitalization efforts in that area. Didn't know if you had the chance to really look at that bill or have been in discussions with that bill over the last little bit here, but what are your thoughts on that proposal, and do you plan to sign that?
Well, I support investment in the West End of Louisville and other areas in our state that have been ignored for far too long. And I support investment in a way that can build wealth of the individuals within the community, and not just simply trying to bring businesses in. I think it's important that the types of investments and decisions about them are made primarily on the local level and include the anchors of the community that help drive change and that know what does and doesn't work. I'll be reviewing that legislation. I'll be talking to various individuals about it, and then we'll like every other bill, we'll address it next week. But let me say, it's a significant piece of legislation because it tries to invest in ways that create wealth within the community, with a lot of community input and even control. And I think those are all the right motivations. Tom Latek from Kentucky Today.
Good afternoon, Governor. We've got one for you and I believe one for Amy here. So, the different vaccines have a different lower age ceiling. So 116 and the other's 18, what have you. Will the website have which vaccines are available at these sites so that people don't try to sign up for it and then find out they're too young? And my second question is, you use the Mayo Underwood building, the new one in Frankfurt, for help with people on their UI claims. Will that also be open like the other new facilities that will be opening up here in the coming weeks?
I'm not sure we have made a decision on the Mayo Underwood building. Let's go over to Amy. I think that is still pending.
Yes, that's right. We're leaving that pending for now, and people are obviously working virtual claims from there. But once we get the staffing situation sorted out for the career centers, then we'll make some decisions about how then we might staff in-person services there, or if we'll keep that as virtual.
And for each individual site, the website or the numbers will only let you sign up if you're 16, if they have Pfizer. By and large, the larger sites and the hospitals are the ones that will carry Pfizer. Certainly the independent pharmacies have J&J or Moderna. Some of them have Pfizer, but your larger regional centers are your best place to do that. Certainly Cardinal Stadium that's going to be opening up is going to primarily have Pfizer. So that's one opportunity if you're 16 and through any other age group and you're ready, that's one to sign up for now. All right, last but not least, Bruce Maples from Kentucky Health News.
Thank you, Governor. I've got two quick questions following up on the prisoner vaccinations. One is, you indicated you're going to get the Johnson & Johnson soon. How many days after you receive it will every inmate have been given a chance to be vaccinated? And secondly, the staff of the prisons have already been able to be vaccinated, and yet many of them have not. So do you have any sort of surveys or data on vaccine hesitancy among inmates? Thank you.
I'm not sure we have the vaccine hesitancy information up front. We'll certainly have good information next week. With the exception of the two institutions, we believe that there'll be the opportunity to vaccinate everyone else in our custody next week. So they're either going to get it this Friday or Monday and immediately go to work. It's only going to take one shot since it's J&J. So the goal is to get that done next week. The other two institutions that have had the large outbreak, we're just following the best medical advice, and we'll be waiting until it's safe. So that is our goal. We believe that there is significant demand for it. We will find out here shortly. All right, everybody. I hope you have a great Holy Week. I hope you have a wonderful Easter. To those of my faith, that is an incredible time of renewal, of reflection, of hope, of knowing we're all special in God's eyes, and the sacrifice that was made for all of us. And I know following and trying to follow in those footsteps, we've made a lot of sacrifices for each other. So I hope we take a little bit of time this weekend to think about the fact that we're just asked to wear a mask a little bit longer or do a few other things, as following the example that we are supposed to follow, is doing right by one another, is living out our faith and living out what we were told is one of the greatest commandments, to love our neighbor as ourselves. So let's commit and recommit, even if we've been vaccinated, even if it looks like the information is pretty good about not spreading it. We don't know yet. And none of us want to harm somebody else when we are called to help them, to love them, and to care about them. So a special weekend that ought to give us all that strength in these last couple months. We hope it's the very last couple months to deal in a knockout blow against this virus. We'll see you Monday at 4 p.m. Happy Easter, everybody.